Thank you all for being here. My name is Kayvon Afsarifard. I'm a psychologist with a focus on chronic pain and mind body approaches to a lot of psychological health related issues. Um, I have my training and background. I did some work with Harvard Medical School at the Brigham and Women's Hospital in Boston. I did lead a 8-week yoga protocol for a remote yoga intervention, which I'll kind of talk a little bit more about at the end of our presentation today. But today's webinar is designed to help you better understand chronic pain, not just what it is, but why it behaves the way it does. And we're also going to talk about some practical strategies that you guys can begin using right away to work with your pain more effectively. Um, so the goal here is just to try to empower you with some tools that can complement the medical care that you're probably already receiving, not necessarily something to replace it. And we're going to explore different themes such as how the nervous system, stress, thoughts and emotions, and movement interact with our pain, and how practices, especially mind-body integrative practices such as yoga and breathing, along with some mindfulness-based interventions, can help calm the nervous system down over time. And as I mentioned, we're going to leave some time at the end for questions, so feel free to jot some things down or if you have some questions as we go. All right. So, first of all, we're trying to understand chronic pain. It's helpful to understand the difference between how it is compared to acute pain. So, our acute pain is short term, it's typically linked to an injury or illness, and it tends to resolve as the body heals. Chronic pain, on the other hand, as you well know, lasts for months or years and can persist even after the tissue has essentially healed. This doesn't mean that the pain is imagined. It just means that the nervous system has become more sensitized to pain signals over time. And that pain is influenced by what we call the biopsychosocial model of pain. And that means that there's biological factors like the nerves and the inflammation. There's psychological factors, including stress and mood, and social factors such as our daily demands and the various social support systems that we have in place. And because of this, effective pain management will typically require that we're looking at this from an integrative approach. So, where are the different places in our lives that we can make some of these changes to have a bit longer lasting effect? So, I'm going to talk a little bit today about pain sensitivity and how this relates to catastrophizing. Um, Chronic pain often increases uh, our nervous system sensitivity, which in the long run can make the pain signals much stronger and even more persistent over time. And this sensitivity tends to get linked or paired with some catastrophic thinking where we jump to the worst case scenario and even sort of an anticipatory fear of how our pain is going to control us or manage our lives in the short term or even in the long term. And while this is understandable, these thoughts tend to increase stress and tension, and that leads to the cycle where it intensifies our pain. We tend to engage in avoidance behaviors. And over time, these avoidance behaviors tend to restrict our movement and ultimately lead to reducing the quality of life, and the different activities that we once engaged in no longer maybe feel as accessible. And so strategies that are mind-body integrated practices, they are aimed at interrupting this cycle. And by doing so, it can help make the body feel safer and more regulated. And as you can see here in this diagram, this kind of, there's an interactional model. So if you've seen maybe the cognitive behavioral triangle where our thoughts, emotions, and behaviors kind of all have a bidirectional relationship. That's a lot of times with chronic pain, what's happening with with our emotions and our thoughts and our behaviors here. So chronic pain being at the top, and seeing how when we're having thoughts about catastrophizing or getting hopeless about our condition, that tends to contribute to the emotions of depression, anxiety, anger. And there's a very high overlap in the literature between people who have anxiety or depression and chronic pain. And these behaviors of avoidance, withdrawal, overcompensation, some of the other behaviors that might not be listed here are things like also substance use. A lot of times you can become over reliant on different types of pain management because what tends to happen is using that medication might help in the short term, but then ultimately it's not a long term strategy. So those are some things to be mindful of in overall chronic pain treatment. We could go to the next slide. So I'm not sure if anybody's heard of the HPA axis. Stands for the hypopituitary adrenal axis. And this is essentially, it coordinates the hormone release in the body as it pertains to stress. And over time, this can lead to significant uh, reduction in the ability to regulate the stress hormone of cortisol. And this increases long term sensitivity to pain. So, whereas you might not have been as sensitive to the pain previously, this enduring longer exposure to cortisol has an effect on different parts of the brain, thereby increasing the intensity of the pain that you're experiencing. So it's not just that the pain is there, but now these other factors that we've talked about psychologically are contributing to the pain actually being perceived as worse. And so another effect of this is something that's referred to as a blunted cortisol awakening response. So in the literature surrounding patients with chronic pain, one of the things that tends to happen is for people without chronic illness or chronic pain, will have a sharp increase in cortisol in the morning. And the effect of that cortisol is to kind of help carry you through the rest of your day. And it slowly starts to dissipate as the day goes on. For individuals with chronic pain, that initial peak is actually blunted, meaning that you're going to be feeling a little bit less energized, or as much of that stress hormone is not working in your favor, because as we know, stress can be positive when it's short term and it's helping us kind of get through an activity. But um, chronic exposure to that hormone then makes it so that awakening response is blunted, and it does start to have an effect on us through the rest of the day. So you can feel more fatigue, you can feel less energized, very much aligned with some of the symptoms that one would see in depressive disorders and things like that. And so when we're talking about the HPA axis, this system can remain activated for long periods and keep the body in a constant state of alert. So feeling kind of like you're just waiting for the next time that pain signal becomes activated. And this ongoing stress response increases muscle tension, also has a disruption of sleep. And as I mentioned previously, contributes to heightened pain sensitivity. And our goal typically with things like a mind body practice, such as slow breathing or mindfulness or even gentle yoga, can help calm the stress response and support nervous system regulation over time. So the goal then becomes is finding ways to become more attuned with your nervous system and being able to effectuate change through a different pathway than has been previously explored.